MedStack podcast, our latest episode. Hope everybody's doing well. I'm very, very pleased today to welcome Aidan from Spebox to our podcast. Aidan, hello.
Hello, great to be here.
Spebox is a company we've been watching for some time, really fascinated by what they do. As I've said before in other editions, digital health has a very important role to play, specifically in delivering care in the mental health space. And this is what Spebox does, specifically around focusing on collaboration to caregivers, patients, and themselves. So Aidan, let me turn it over to you. Maybe you can quickly introduce the company and the specific approach and unique approach you guys are taking to this space.
Yeah, thanks again for having me. Really excited to dive into these details. You really know how to get a founder on a show. Ask them to talk about their why in their business. Spebox acknowledges that if we want to make healthcare better, we need to address the systemic problem that practices from one to organizations of hundreds face every single day, whether they're in Canada, the US, or elsewhere. And it's that we have ignored one of the most valuable members of any care team, which is the patient. We've built systems that are system-centric to the healthcare industry and abandoned patients. They're really at the fringes. They might have a patient portal. Patient portals are ridiculous. They're designed for scheduling and for billing. They're not designed to improve care outcomes. And at the same time, we've got this tidal wave of people needing access to mental health care. We do not have enough therapists to meet that demand. So now more than ever, we need to double down on looking at outcome-based measures and what can we do to make therapists more efficient and get them to do and focus on what they actually love to do, which is provide care, not run businesses, not be distracted by administration. I'll leave on one stat, 470 hours. That's the amount of average time therapists spend every year just handling administration within their practice. That's a whole day a week that they could better be utilized seeing patients. And we really want to help unlock that for them.
How did you come across this problem and the specific characteristic of improving efficiency for therapists?
I came across this problem first as a patient. I was 18, I was just out of high school. And yes, in my story, like so many, trying to find and access mental health care was difficult. But what really stuck with me was my frustration during care. I felt alienated, isolated, confined to this 50-minute session to try to get well. And in that 50-minute session, if any of the viewers have not been to therapy, you're covering history, you're trying to learn a new skill, and it's a lot. And you're dealing with the mental burden of whatever you're dealing with. And so here I was, I'd gone through, unfortunately, a really rough childhood, could not manage anymore and urgently needed support for my mental health. And when I needed healthcare most, here I was as a spectator. And so it completely changed my direction professionally. Instead of going to architecture school, I ended up going in a direction towards project management, ended up in healthcare, specifically within quality improvement, which is a really fascinating field in healthcare because it gives me the visibility into healthcare delivery systems. Not only did I see a lot of EMRs in my history, I saw large organizations like large children's hospitals here in Vancouver, but also working in community with nonprofits, with really small practices to understand their workflows and understand the variety of services and software used to power these different types of healthcare delivery. And ultimately came to the understanding after 8 years working in that space that all of the systems have this fundamental flaw, that they're not integrating patients effectively. And this is not only creating inefficiencies within our healthcare system, it's impeding care. And it's, again, going back to that nuts and bolts of managing practices. It's impeding therapists' ability to be effective. And so that really was the nail that drove me to say, hey, somebody's got to do it. I've worked in quality improvement. I've seen it. My specialty is in human-centered design, which means I involve the people who are going to use this solution in building this solution. And that was really the foundation of Spebox. And we've never looked back and we've never stopped including our audiences in continuing to build our product.
That's a really great story. I really love how you characterize that because to me, that is the exciting thesis of the whole digital health ecosystem. the first things that we ever thought of as being digital health were, I mean, they're necessary, but it's also a little unfortunate, as you characterize it, was simply from the operations of healthcare outwards. It's like, what are the processes? How do we digitize them? Maybe make them work a little bit more connected. But so many of these new companies that have been created, I've noticed have sort of three important characteristics which you've reflected on. The first is they're created by personal story. The second is they're created from a patient centricity perspective. Usually patients saying, how could my experience have been better? And it's not the fault of the people who work hard in healthcare, it's the systems they have available to them and the systems that the patients have available to them. And the third is they're usually very, very specific on like one problem that is personally important to you to solve. So I love how you characterize that. It's what we see constantly in this whole ecosystem. So tell me a story. So when was that, and what's happened since?
Yeah, so that first inspiration was 2017. And I think that's also a really important, just quick note on that. You know, these companies don't get created overnight. They definitely created overnight in healthcare, because one thing that we take very seriously, speaking about MedStack, you know, security and compliance is incredibly important to us. We're deployed in practices in Canada and the US. We have to deal with PIPEDA standards. We have to deal with HIPAA standards. This is something that's really important to us, and is not something that we can cut corners on, even as a new organization within healthcare. And we could have another conversation where we think maybe too many people cut corners at the earliest stages in startups on that. So we incorporated in 2017. We did enormous amounts of research. Like I said, day one, it was all about prioritizing, talking to therapists, talking to patients, understanding those workflows for us. COVID happened, jumping way ahead. And we got the product to where we were feeling uncomfortable, but optimistic. And that to us was the indicator, like, great, we need to go to beta. We know we're compliant. Let's go get it in practices, get people using it in real world situations so that we can continue to drive that feedback. We drove that through most of COVID. Fingers crossed that we're going to come to the end of that thing sooner than later. And now really we're accelerating. So we recently went through Techstars. We were in Boston. Phenomenal for connecting us to a lot of US networks that we previously didn't have access to. And now we're back here in Vancouver, having just recently wrapped up that program, currently doing fundraising, which, as you know, is a lot. It's a headache, but we're really excited about the future and where we're headed now that we've just grown exponentially from the knowledge we gained, especially during Techstars. Never have we had the clarity that we have today, both on roadmap, but just also from an organizational perspective. Like, what does it take to run a startup? What are the type of partners that we need to find? Now we're aggressively going out and trying to build those relationships and find those folks.
Yeah, I'm very curious about that. So congrats on finishing Techstars. You said something just now about you have a lot more insight and knowledge about what has to go into your product in the short term, based on the feedback. Is there anything you can share about like a one big learning you guys have achieved, maybe during the Techstars program or sort of in general the past year and a half?
Yeah, the biggest thing that we realize, we're always having to strike this balance at Speakbox, because we do have this two-sided support. We've leaned deeply into the patient, into the client experience. And of course, we're a B2B SaaS company. We charge therapists for our platform. We need to be a full functioning EMR, and we need to allow them to manage their businesses in effective ways. And so we're always dealing with restricted amounts of resources at an early stage of a company, and how do we maintain value to those two audiences? And so for us, a lot of the clarity has come from being really efficient with the extra values that we bring to the public and focusing that value. Right now, we're really focused on the relationship that they have with their therapist. So we're able to now build elements on Speakbox that ultimately serve the practice, ultimately serve the therapist by giving them, better scheduling, better ability to document, better abilities to just have oversight and insights into their organization. But by doing that, the way that we go about building it is we see, scheduling, fantastic example. It's such a table stakes feature within the industry. But then we look at it from the patient's perspective and say, like, yes, here's the therapist workflow, but what does the patient have to do? And every time we build these table stakes features of an EMR, we're always asking ourselves, well, what does the patient have to do in that workflow? And that's how we're always building a better moat. That's how we're always building better differentiation. Because to the point that you made earlier, it's no longer about just digitizing what was analog. That's what got us in this mess in the first place. If we're going to build a modern EMR, build the future of healthcare delivery, then we need to go further than that. We need to be very aware of what does interaction look like, particularly in the digital space. COVID showed us that and taught us that. This Zoom meeting is great for this conversation. It's not that conducive to therapy. There's so much lacking and missing from it. So that's really excited. That was very vague. I also recognize some more concrete things that we're really excited about. We formed a partnership with a group called Reimbursify in the States. It's going to allow us to streamline reimbursement for out-of-network folks. Really, again, bringing value to the patient and to the therapist in that relationship that we're really excited about. And we're talking to a number of top-end organizations that are helping with that therapist matching, therapist marketplaces, and finding ways that how could we potentially integrate with them, how could we partner, and how could we work with them. Some really still under inside the tent particular on who those folks are, but we think that that's going to be quite compelling. And then the last thing that we're really excited about is looking at what is the next generation of therapists that's coming through the pipe? Who's going through the education system right now? And what are their opportunities when they graduate, when they become, and where could we potentially support them in that process? Because the last piece that I think is really important is not just looking at EMR as a data management system, but looking at it as a system that is partnering with these clinicians. And these clinicians are managing businesses. What can we do to help them drive a better business? What can we do to help them stand apart in a very crowded space? And so that was a really fascinating conversation for us right now as well.
That's super interesting. Yeah, you're thinking very holistically, which I really like. So I guess the last question I'd ask is, where can people find you, and what is the one thing that you'd love our audience to sort of take away, and what's happening with Speakbox recently, and how maybe they can help?
Yeah, speakbox.ca, best way to find us, speakbox.com. We would love to have that URL